What are regenerative cell therapies and how are they helpful in the spine? You know, there are different types of regenerative cell therapies, and we actually use some during surgery sometimes too to help promote bone growth and healing. But in order to keep you away from surgery, we're trying regenerative therapies of cell types. Some are cell therapies like stem cells and variants of that, and some are actual protein molecules that prevent inflammation. And these can be injected into discs and into joints of the spine. Now, we have done some trials already on injections in the discs with stem cells and other modalities. They haven't been that promising, to be honest. They're 50-50, which isn't great. We really like 80% effective. So for the most part, these therapies work. The anti-inflammatory molecule injections seem to be much better, particularly A2M, which stands for alpha-2 macroglobulin. It's in your blood. We take your blood, filter it out, like PRP, you might have heard of that, platelet-rich plasma. And we mix this A2M molecule in that and put it in your discs and in your joints. And it has some benefit in reducing inflammation dramatically. So those treatments are available, and we can talk about those when you come in. Thanks.